So I'm glad that everybody's coming back. Like I said, it seems like the challenge, the gauntlet has been laid down is keep on time. So I want to make sure that we can follow the great, the example from our first session. So I'm going to go ahead and get started. I know people will be coming in, but I'm going to be doing introductions for the speakers. So my name is Chris Lathan, and I am a medical oncologist at Dana-Farber Cancer Institute, and I will be the moderator for your second session, where we will be focusing on challenges in the implementation. And the reason you don't see my slides up is I'm doing double duty as a both moderator and speaker. So you'll hear more about what I'm going to talk about, which is specifically disparities and looking at specific groups, African Americans, in the context of lung cancer screening. And I want to give you an idea about some of our other speakers, introduce the rest of our other speakers. And I want to thank the chair for giving me the hardest names to pronounce of anybody else. So please bear with me. No, wood is not hard, and black or not. That's not hard to pronounce. Before I do that, actually, I do want to say a couple things to give you a framework and focus. So, what we're talking about here is not just challenges. I actually like to think of it as real-world challenges, and specifically, we're talking about the who, the how, the issues with focus, and the execution of lung cancer screening. And we're kind of in this early period in lung cancer screening, so we don't have a lot of data, but you're going to see from all of our speakers that people have already had some thoughts about what we can do with some of the challenges. So our first speaker today will be Martin Tamagi. Did I say that correct? Close enough. I'm so sorry. I knew that was going to happen. But so Martin actually is a professor of epidemiology at the Department of Health Sciences at Brock University in Canada. He's also a senior scientist at Cancer Care Ontario and is acting as the scientific lead in Cancer Care Ontario's high-risk lung cancer screening pilot studies. He's been a co-investigator and remains an active analyst in the PCLO and NLST studies as well. And he's going to specifically talk about identifying high-risk populations for screening and risk modeling. Following that will be Dr. Douglas Wood, who's a thoracic surgeon, currently at the University of Washington. He's professor and endowed chair in lung cancer research in the Department of Surgery, and his academic work has really focused on the field of thoracic oncology and outcomes research. He's been a co-investigator in several grants relating to the role of PET scans in staging, prognosis, and responses to lung cancer therapy, as well as some health services research with the SEER Medicare database. Dr. Wood sits on the panels developing the lung cancer treatment guidelines, specifically NCCN and the American College of Chest Physicians. And I think he's going to talk a little bit about the guideline development, and I'm sure there'll be some interesting discussions given the first panel. And then I'll talk about disparities in lung cancer screening. And following me will be Fabrice Similaskis. Did I get that right, Fabrice? All right, at least I got one of those right. So Fabrice is at the University of Chicago. He's assistant professor in the Department of Public Health Services and co-chair of the Cancer Policy and Outcomes Work Groups in the Comprehensive Cancer Center at the University of Chicago. He's specifically a health economist and health services researcher who studies biomedical technologies with a focus on novel cancer therapies and cancer imaging. And one of the major research themes is the use of classes of technology and the value they provide in the healthcare system. And he's specifically going to be talking about capacity constraints and geographic variation. And then this will be followed by Dr. Black from Dartmouth Hitchcock Medical Center, who's a professor of radiology and community and family medicine. And he's actually the principal investigator at Dartmouth Hitchcock and member of the executive committee as well. He's played a major role in the design, execution, and analysis of the National Lung Cancer Screening Trial. He's led the cost effectiveness analysis there, and he's going to specifically talk about radiology workload and follow-up considerations. So we'll go ahead and get started with Martin.